severe respiratory virus sending kids to hospitals in the Midwest now may have spread to the Spokane area. Tonight, 2 on Your Side asks how you can tell the difference between enterovirus and the common cold.
KREM7 News at 5 starts now.
It's good to have you with us. I'm Jane McCarthy. Randy is off tonight. A severe respiratory virus spreading across the country may have made its way to the Spokane area now. Spokane Regional Health District officials confirm they are investigating a severe respiratory illness in one area child to see if it is EnterovirusD68. Health officials encourage local health care providers to consider enterovirus as a possible cause of acute, severe, unexplained respiratory illness. If it does appear locally, large numbers of children could develop respiratory infections in a short time period. As the virus does spread easily, it's similar to the common cold. Enterovirus isn't something many of us have heard about until quite recently. So, 2 on Your Side's Jenica Villamore is breaking down the differences between this and the more common cold. Jenica?
Now, I just spoke with a doctor from Sacred Heart Children's Hospital who told me the symptoms are very similar to the cold, only much more serious. Now, the viruses begin very similar. It starts the same way with coughing, congestion, a runny nose, sneezing, and sometimes wheezing. But with EnterovirusD68, all of that is severe. For instance, wheezing could get to the point where someone needs oxygen. However, doctors tell me there are many kinds of enteroviruses, and it's common for people to get it around this time of year. However, this strain has just become more prevalent and has made more people sick than usual.
I mean, I think the big thing is just not to freak out and panic. It's a respiratory virus. It can definitely make people sick. Just because you have cough, congestion, runny nose does not mean you have enterovirus. Just because you have cough, congestion, runny nose does not mean you should rush out to the ER.
And even if you have EnterovirusD68, I'm told people can push through the illness the same way they would with the cold. Now, Watkins says the emphasis should be on prevention, like washing your hands and covering your cough and keeping your hands away from your face. Now, I just spoke with the Washington State Department of Health, and I'm told the number of cases has jumped from 15 yesterday to 29 in Washington today. And that includes cases in King, Yakima, Snohomish, Grant, and Spokane County. Now, although all of these have occurred among children, I'm told adults can get the virus too. Meanwhile, no one in Washington State has yet had a confirmed case of this particular virus. Reporting live in Spokane tonight, Jenica Villamore, KREM7 News.
Well, there is a lot of information here, and we want to be sure you have the facts you need to keep your family healthy. KREM7's Rashad Hartnett is here with a closer look at the symptoms and how you can avoid spreading the virus. Rashad?
Jane, the cases keep appearing across the country, and it seems to be heading closer to Spokane, so we want to make sure you know what to look for. Here are some of the symptoms to look for if you think your child could have the enterovirus. The first 2 are similar to any common cold, so pay special attention to the last 3. Fever, runny nose, coughing, sneezing, skin rash, mouth blisters, body and muscle aches. And now there is no vaccine for the enterovirus, so doctors say good hygiene is the best way to avoid getting sick. So make sure you wash your hands often, avoid touching your nose and mouth, avoid kissing and hugging people who are sick, and disinfect frequently after touching surfaces. Now, if your child has any of these symptoms, make sure to get them to a doctor right away. Reporting in the studio, Rashad Hartnett, KREM7 News.
Rashad, thank you. Also, Idaho health officials on alert for enterovirus. So far, 9 people have been treated at Eastern Idaho Regional Medical Center with symptoms consistent with that virus. Preliminary tests show the children who are ill have tested positive for that virus.
The hospital is preparing for an increase in respiratory cases by increasing our staffing and making sure that we have proper equipment. We're meeting on a daily basis to evaluate the need.
Well, that hospital has also implemented visitor restrictions. No one under the age of 18 is allowed to enter the hospital unless they are a patient or the parent of a patient.